A good morning, a good afternoon, a good evening to everyone once again, and welcome to today's webinar. This webinar is brought to you by the Global Health Network's AI for Global Health Hub. The title and the topic for today's webinar is How to Tackle Health Technology Innovations, with a focus on the case studies from Africa. It's the second in a regional series that discusses the transformative power of AI in healthcare. AI has recently been described as a disruptive technology, and it's bridging gaps in healthcare. Because of that, several professionals have been drawn to the field of AI. This webinar will present insights from startups and sub-grantees of the IDRC-funded AI for Global Health Hub, highlighting their challenges and their solutions. The goal is to guide and inspire entrepreneurs, investors, healthcare professionals, researchers, and policymakers towards ensuring the ethical and responsible use of artificial intelligence in healthcare, with a focus on the African landscape. My name is Prince Ebenezer Adjei, and I'm the coordinator for Africa for the AI for Global Health project. I'm also in the AI team for the Global Health and Infectious Disease Group at KCCR-KNUST. We'll take some opening remarks from Samuel Oti from IDRC, and then from our partners, Villgro Africa, York University, and HASH, the Hub for Artificial Intelligence in Maternal Health and Sexual Reproductive Health. Then we'll go and take introductions from sub-grantees of the IDRC-funded AI for Global Health Hub, from the University of Ghana, and also from Neural Labs Africa. So before we begin, a few housekeeping. First of all, please note that this webinar is being recorded and we will share it on the Global Health Network platform. You can use the chat feature to introduce yourself or for any technical assistance. Please use the Q&A feature to post your questions and topics. You can do that anonymously as well. Due to the number of participants we're expecting or who are here, your camera and your microphone have automatically been disabled. We may give an opportunity at the end of the session to ask questions. If we do so, kindly raise your hand virtually and your microphone will be enabled for you to ask your question. The webinar will be held in English. However, simultaneous translations will occur both for French and Arabic. Unfortunately, Zoom only allows a limited number of languages. So when you check the interpretation feature, you may find German, but it's actually Arabic translation that would be going on. So for our agenda, like I mentioned, we'll take opening remarks from IDRC and from our partners, and then we'll introduce the sub-grantees who form the panel for our discussion. I will do a brief introduction about the AI for Global Health Research Hub, and then we'll zoom in straight to discuss some questions, and then we'll take a Q&A session after that. Please also note that the recording, the materials, and the presentations will be shared on the AI for Global Health Hub. The link is as you can see on the screen. So we'll now move straight to take opening remarks. Of course, this is an overview of the distribution of registrants. So we have quite a number of people here from diverse portions of the world, largely from Africa. So it's quite exciting what's about to happen. So we'll take the opening remarks from Sam from IDRC, and then we'll continue from there.
Hello, everyone. First of all, my sincere apologies that I am unable to participate in this webinar in real time due to other competing priorities, but I'm grateful to the organizers for the opportunity to deliver some brief remarks. My name is Samuel Oti, and I am a senior program specialist with Canada's International Development Research Center. I am based in our regional office for Eastern Southern Africa, which is here in Nairobi, Kenya. For the past 50 years, IDRC has been investing in knowledge, innovations, and solutions to some of the most pressing development challenges in low and middle income countries. Essentially, we fund research and innovations that are led by researchers and research institutions in the Global South. And our goal is to support people in the Global South to find innovative solutions to their own development challenges. Now, one of our major areas of research funding is in global health. And within this program, we have two areas of focus, one on pandemic preparedness and response, and the other on sexual reproductive health and rights. Now, across both areas of focus, we are investing significantly in advancing the role of artificial intelligence, or AI, in health. Specifically, we have an initiative known as the Artificial Intelligence for Global Health Initiative, AI for GH. And this initiative is a 5-year, 15.5 million Canadian dollar investment. It funds researchers in the Global South to strengthen health systems by leveraging contextualized, responsible AI solutions to improve SRHR and to support more effective and equitable preparedness and response to epidemics and pandemics. We understand that the use of AI is transforming how health systems are planned and how health systems are delivered globally and increasingly in the Global South. We know that when AI solutions are implemented using people-centered and rights-based approaches, that they can create efficiencies and accelerate the achievement of health-related goals, such as SDG number 3. However, we also know that despite the promise of AI to improve global health, there are important ethical, legal, and social implications that, if not appropriately managed and governed, can translate into acute and protracted risks to individuals and populations. And these risks are more pronounced for women, racialized groups, and other vulnerable groups. Therefore, the goal of our AI for GH initiative and other related investments in AI is to promote the development and deployment of responsible AI solutions for health, specifically in the Global South. And by responsible, we mean solutions that are ethical, inclusive, rights-respecting, and sustainable. Solutions that aim to strengthen gender equality and inclusion, and that integrate plans for sustainability, scale, and influence. So I'm pleased to say that 3 of our partners in the AI for GH initiative are the co-organizers of this webinar. We are so delighted to be working with TGHN, Villgro, and New York University on this initiative. As the saying goes, if you want to go fast, go alone. But if you want to go far, go together. And the journey to advancing responsible AI is one that we see as a marathon. And so we believe that it is necessary to build a community of practice, a network of like-minded organizations and individuals working towards this common goal. And this webinar is a testament to the fact that we are on the same page with these three partners in terms of bringing people together to share knowledge and to learn from each other. So I'd like to congratulate all the partners for taking the initiative, and I appreciate the presence and participation of all of you here today. Together, I believe we can contribute to advancing the use of responsible AI in bridging gaps in healthcare across the world. Thank you for your attention, and I truly wish you all a very fruitful webinar.
Thank you so much, Sam. We'll go and take short introductions from our partners joining us to co-organize this program. So, Lizwa, over to you.
Thank you so much, Prince. Good morning, everyone. And thank you for the opportunity to come and interact with you all. I'm Liswa Luhlanga from the AI for PEP program, which is housed at York University. Today, I'm going to give you an overview of what we do at AI for PEP as we work with different organizations that are committed to the AI, but if basically committed to the pandemic and epidemic preparedness mitigation and response agenda. Thank you. As you may all know, we are supported by the IDRC. We are part of the few organizations that were successful to earn a seed grant. So my presentation today will look at the AI for PEP network, basically expanding on what we stand for and what we do. We have a unique approach to what we do, or what I'll term our broader vision. And then I'll also have a brief demonstration basically on the projects that are rooted in different parts of the world, because you may know that we are a global program. And then I'll offer my conclusion. So the Global South AI for Pandemic and Epidemic Response, AI for PEP network is a multi-regional network of interdisciplinary researchers and policymakers across Africa, Asia, the Latin America, and the Caribbean, as well as the Middle East and North Africa region. Our network seeks to strengthen epidemic and pandemic response initiatives that leverage on artificial intelligence by building equitable and efficient public health preparedness and response to infectious disease outbreaks. We are rooted in 16 countries across the Global South. These are all lower and middle income countries. As you may know, that the impact of pandemics and epidemics much intensified when they hit the Global South because of existing socioeconomic issues. Our local nodes generate locally relevant data and relatable data to inform responsible AI solutions through a One Health approach. We know that we are moving towards an integrated regime of health, where we know that there's an interdependence between human beings, plants, and the whole ecosystem, hence the use of a One Health approach. Okay, to expand on our vision, we are rooted, our foundation is rooted on the UN Sustainable Development Goals, SDGs 3, which is for health and well-being, as well as SDG 5 for gender equality. And we work on 4 main themes where we explore timely and relatable data for public health decision making. And then we committed to a resilient, strong, and fair health systems. We take an unapologetic approach to gender equity, inclusivity, and decoloniality for vulnerable groups. We understand that, health or equitable health is not a one-size-fits-all, hence the need for extra sensitivity when it comes to gender and decoloniality. And then the last one is adopting a One Health approach that integrates or combines all these domains. I wanted to add this more just to show the different or individual programs that we have that have different and unique projects that respond to their local context, feeding onto the themes that we explore. We have projects that, for example, use artificial intelligence to have a fully fledged program for early warning systems for improvement of public health. We have other programs that are committed to TB, using AI to mitigate TB, having early systems and a whole digital infrastructure that responds to early infectious disease warning systems. We have programs that also look at like our South African program, which is committed to air monitoring, air quality monitoring as a way of early warning systems. We have also programs that look at water sources, just wastewater monitoring. Those are all the programs that we have. You can actually have a closer look. If you visit our website, you can actually have a sense of all the programs that we are supporting in the different parts of the world. Our project is pretty new. We just finished dispersing our grants to our 16 recipients who had responded to our call. But we are very happy at the progress that we've been seeing from all the partners, the enthusiasm, their appetite for collaboration. We have bi-weekly check-in meetings where we get to know about all their progress. And we are proud to say that at least 6 of our projects have successfully launched their local chapters, which means they have established themselves as key leaders in their epidemic and pandemic preparedness agenda, connecting with governments, with civil society stakeholders, and experts on the ground. Their websites and social media sites are in place. We have actually celebrated our first submission of 4 regional papers that were compiled and sent to the United Nations on artificial intelligence governance. The work that is happening in parallel. So Africa, Asia, Latin America, and the MENA region have all taken, up the challenge to say we want to establish ourselves as regional leaders in the field. And as a secretariat, we continue to provide strategic guidance and support to our local partners. We are also at our early planning stages of our inaugural AI for PEP Global Congress, which is to be held in 2024. And we are happy to share more details as we evolve towards this. But it's an exciting thing that we will be meeting all the regional chapters and also partners who are like-minded to think together, to collaborate and explore new ideas. Thank you.
Thank you so much, Liz. Wow, that was excellent. That was excellent. So that's about York University. I'm sure if you have more questions, kindly visit the site and find out more. We will now take a brief introduction from Favor.
My name is Favor Caesar Wisdom. I'm here to represent HASH. HASH is a consortium of multidisciplinary partners ranging from IDRC, Sandbird AI, Makerere University, College of Computing and Information Sciences. The HASH is composed of 3 partners, and these are our investigators. The first one on my far left is Dr. Rosalind Ratanshi. This middle one is Dr. Mwebaze Ernest, and extreme right is Professor Baina Mugisha Engineer. We are an African-based research hub and network for AI in maternal sexual reproductive health in sub-Saharan Africa, based in Uganda. Now, why is maternal sexual reproductive health important? Next page, please. Why is it important? We picked on that topic, the consortium picked on that topic because globally, there are more than 1 million STIs acquired every day, and mostly are in Africa. Now, in Africa, constitutes their youngest population, and girls between 15 years to 19 in 2000 to 2021 we have a UNFP World Report. This dashboard is showing the adolescents' pregnancy rate. The one that are intense blue colors, it is showing the gravity of, or the intensity of that pregnancy rate. I think the display is blurred. I think whoever is working on the display is not coming out well. So I can see what I'm working on properly. All right. Now, with that one, you would see that the dark blue shows where this rate is so high, and the light blue shows where the rate is very low. And this shows why we are so much interested in this type of topic. The next picture, please. No, that's the next slide. There are around 4 maps of Africa there. Yeah, there is that one now, that next one. As you may see, that also indicates the mortality ratio in Africa. And these are mothers who die because of pregnancy-related causes within 42 days or during pregnancy. And it is showing the map of the entire universe, with the red part, which is intense red, or maroon, as you may call the color, showing the intensity of happening of this kind of things. And most of them are happening within Africa. So that brings this issue of maternal sexual reproductive health being of great importance to us. And the last one is the digital strategies for the African nations, that last picture down there. Now, at least almost each African country has a digital strategy. It's about around 3 countries that lack a digital strategy. So that's what really has prompted us to engage into maternal sexual reproductive health. Given that, one, this is a pressing issue to the African continent. Secondly, there are digital strategies for African nations to leapfrog into tackling this issue with technology. And the emergence of AI would help us address this issue with a lot of ease, given the tech savviness of most of the adolescents around Africa. The next slide, please. Now, those are our sub-grantees. And these sub-grantees are all over Africa. But the most important thing, what is the strategy for this? Our strategy to tackle this, first of all, as a hub, is for stakeholder engagements and research around, prioritized around intersectionality of AI and maternal reproductive health and systems strengthening within sub-Saharan Africa. The other one is to support the development, deployment, and scalability of homegrown AI solutions for maternal sexual reproductive health through a section of sub-grantees. The other one would be capability and raising capacity building, knowledge sharing, and mentoring of African inventors on the ethical and responsible application of AI in maternal sexual reproductive health. The last slide, please. This one shows the distribution of our sub-grantees throughout the African continent geographically. you see that there are those right from the west, far north of west, and those from the east, then and the south. But in relation as well to the mapping, you'll find out that those sub-grantees, it was intentional that they were picked from main areas where these issues were most prevalent. And this includes Nigeria, Ethiopia, Uganda, Namibia, Tanzania, Ghana, Kenya, and that constituted the number of our sub-grantees. Thank you so much for listening.
Thank you so much, Wisdom, for telling us about HASH and your sub-grantees. We'll quickly take a brief word from Villgro Africa, and then we'll proceed. So Villgro Africa, Dr. Adjei.
Thank you very much, Prince. Right, my name is Adjei. I am an AI sector lead at Villgro Africa. Villgro Africa is an early stage incubator where we are trying to support AI innovators for healthcare in Africa. One of the things that we came to learn is most of the funding in AI, which was coming mostly to Africa, was going into academia research, and the private sector was a bit isolated. So as Villgro, together with our partners, the IDRC, we decided to look into that area and support these young stage, early stage innovators. And so far, for the past 7 years at Villgro Africa, we've invested over 2.1 million seed funding to different companies. So the way we operate is sometimes we support these companies, or sometimes we take a small share from these companies while we make sure that they are going to research, develop, and implement responsible AI solutions. So far we've launched 2 calls. The first one was to understand what was happening on the continent. Next slide, please. Yes. The first call which we launched, that was 2 years ago. It was general. For healthcare, agriculture, finance. Then we came to learn that most of the AI innovations which was happening on the continent was on in healthcare. So based on the first initial call, which we received over 200 applications, but we ended up picking 10 companies. We came to learn that most of the AI innovators, especially in the private sector, were self-taught. Like they're just kids teaching themselves how to develop different AI solutions, which was a very risky because as we all know, when someone is teaching themselves in their bedrooms and code, sometimes it's harder to have ethical development of these solutions, like the way they obtain data, the way they deploy their solutions. So as at Villgro, we decided to look into that area and to try to support these young innovators to make sure that their solutions are going to make to the market while we are protecting the mankind. So based on those learning, we decided to launch another call, which was came out this year, and we are proud to have one of the beneficiaries in this call, and we've been supporting these young innovators not only financially but also technically to make sure that the solution they're developing are going to be responsible. Next slide, please. So you can actually look at the 10 companies that we supported last year, and this year we decided to focus only on healthcare. Next slide. Yes, and based on our learning, we decided to bring in more partners to make sure that our learnings, which we did in the first call, are going to be implemented. And we are proud that we have NVIDIA, because one of the challenges that we came to learn is computing power. Many of these companies were struggling on how to train their model, resources, online credits. So we are very proud to have NVIDIA, who have issued around 100,000 USD worth of credits for cloud computing. And also we have Siemens Healthineers, who are supporting the implementers of AI in healthcare. So to make sure that these solutions are being developed ethically. And also we have J&J Impact Ventures, who are also investing investing to support these companies, and IDRC, who are together we are providing training to these companies. The last slide, I think. Okay, so in this year we have launched another call in which we received over 200 applications from more than 20 countries in Africa, and we are still incubating these guys, and they're all focusing in healthcare. Thank you very much.
Thank you so much. Excellent. All right. So we've heard from the partners, and I think this is very insightful. Particularly the last one, where we are hearing that there are avenues for entrepreneurs who want to venture into AI related work. There's funding available, and you can reach out to these groups. Okay, so we'll zoom straight into our panelists and then enter into the discussions. Before we do so, for those of you who don't know about the Global Health Network, the Global Health Network works across all aspects of health research to address three main aims. First, we would like to bring support, training, and guidance for easier and better research to places where it's missing. Secondly, we would like to enable an open environment where information can flow freely to ensure there's equity. And then lastly, we like to build lasting, capable research teams, particularly in low-resourced settings. So for the AI for Global Health project, there's a central repository for AI and global health research that brings to bear latest research practices and ethical considerations for all those interested in artificial intelligence as it relates to health. Then our goal with also such platforms is to foster a community of practice, a group of researchers, entrepreneurs, stakeholders who have one thing in common. In this context, that's AI for global health. So there can be exchange of knowledge, and we can support the development and implementation of AI technologies and solutions to improve health. So our goal is to create a platform where we can talk to each other and not work in silos. That's the primary aim of the Global Health Network. And so that's something small about that. So we'll move straight to the sub-grantees. These are the people actually doing research who are in the entrepreneurial dimension as well. And we'll hear from, we were supposed to have three people. The last person couldn't make it from Jima University, but we have Michael Kojukolugu from the University of Ghana, a sub-grantee from HASH, and they are doing some excellent work in AI, how they are applying it to sexual, maternal, and reproductive health. So, Michael.
Okay.
Briefly about what you are working on.
Okay, right. Good morning, good afternoon, good evening to all of you, wherever you're coming from. So I just not sure, please, can you hear me?
Yes, Tom, we can hear you.
All right, good. Okay, thank
you.
Sorry,
Michael, we can hear you.
Okay, right. So well, my name is Michael, with a team from University of Ghana. In the name of Dr. Sylvia Jan and Dr. Abigail Mills. And we are a sub-grantee of the HASH group. And our research asks the question, how can AI be used to promote improved sexual and reproductive health outcomes for adolescents with hearing, speech, and visual disabilities in Ghana? Okay, so and basically the rationale is to utilize machine learning to remove the barriers that adolescents with hearing, speech, and visual disabilities face in accessing SHRS information, sexual or reproductive health information and services. So this is exactly what we're doing, and so far the process has been smooth. We've had we are just about to start going to the field. I think I think I'm going to leave it here. Thank you. In the course of the presentation, questions will come. We'll give our input as to what we have done, what we have planned to do, and the challenges that we face, the challenges that we're anticipating, and how we intend to solve them. Thank you. Thank you very much.
Excellent. Thank you so much, Michael. Thank you so much. And so we can move straight to our questions. I think this is where it's getting extremely interesting. Let's go to our questions, and then we will delve into some of the challenges and some of the solutions unique to implementing AI within the context of Africa for healthcare. So the first question would be, what were the main challenges of your AI project, and what solutions have you developed or adapted to overcome them? Right. So we are thinking about the challenges in terms of conception, development, deployment. What would you say the main challenges have been? Michael.
Okay. I seem to be the only one on the panel today.
Yeah.
It's going to be interesting. Okay, so well, let me just start straight from conceptualization. So, in effect, the call came in and we met. Myself, Dr. Jan, and Dr. Mose, and Dr. Jan's office. Ideas started, different inputs, perspective from varied research backgrounds came in to shape the idea, moving it from just an idea to something that is achievable. Well, given the current logistic and technological constraints that are available. I guess at this stage, the challenge is actually not having complete picture or knowledge of the extent to which the available resource can support the idea or project. Bearing in mind that the mix of the project duration and the fact that prices of resources and services for the project usually do not stay still. So the strategy is to always keep the following in mind. I think one, the available resource; two, the duration of the project; and three, I think the wildness of your imagination or the wildness of the project, if I should put it that way. Well, you can see that 1 and 2 you cannot do much about, because the calls usually come with the duration and the available funds. And sometimes, just sometimes, portion of those funds have, some predetermined functions that are not made immediately known to the call when the call is made, unless you read further, you inquire further. So then that means that the only option you're left with is to put on some sort of a regulator on the wildness of your idea. You see and the continuous this challenge actually tends to not just even at the conceptualization stage, but through the design, the development, and deployment. I see it that way. Well, I think if there. Okay, I thought someone was saying something.
No, I'm
okay.
not.
Okay, so for us, I think that is what we try to do, to be able to regulate the scope of the project. Currently, we've done we are now about to go to the field to go and collect data. We've done the pilot survey. And like I just said, still the sort of the way you have to regulate your idea runs through. Maybe if there are some sort of possible way to extend But usually these are not the case. I guess, again, heavily for me, it's on the regulation of the idea.
Okay, so I hear you say that in terms of being able to conceptualize the application of AI in the context you are working in, vis-a-vis the time allocated for the call, for responding to the call, it sort of can click how wide your imagination is. Is that correct?
Okay, so my point is for the project, not just the time you use to respond to the call. So what I mean is the duration for the entire project.
Okay.
Okay. You've been asked to look at how to use AI to solve a particular problem. You can, maybe the amount of work that will go into it can span more than, I mean, if you open up your imagination very well, the amount of time that you can use to solve that particular issue can span over the duration. I mean, it can go over the duration of the entire project. So it means you have to regulate that idea and let it fall within, bearing in mind also the available resources in terms of the funds that are there for you. So the only thing that I see in this particular situation is for you to regulate it. Just to be within the available resources. Yes.
Excellent. And just for information, dear partners, you can jump in at any time to make contributions to the ongoing discussion. I think my takeaway from this question, particularly for students or research groups that are thinking of doing work related to AI, I would say you should probably have a draft proposal there, right? Have an idea that is sort of clearly written out, or you can clearly articulate, have it there somewhere, because you never know when a call would come, right? So you could modify it and make it suit a call. Would you say that's a good advice to give, Michael?
I think yes, it is. It is a very good advice to give, and also in coming up with your in addition to the brilliant advice you've given, in coming up with your budget for the project, you have to really put these considerations in there. Yeah, with the cost of the resources, the duration that you have, all of that. Knowing again prices of these services and resources. Do not stay still. And to some of us, for instance, we are a bit fortunate with regards to Sunbird being there for consultation, just in case we run into any specific technical problem. So these are the things that you have to look at. So for us, some of the things are already taken care of with regards to such consultation. So yes, so know the available resources that are there and try to live within those resources, I think.
Excellent. I think it's very good advice for research groups, potential research groups in AI. All right, let's look at another question. And I find this quite interesting.
Hello.
Yes, hello.
Can I make a short contribution before you move on to the next one?
Please come in. Please come in.
Okay, thank you. Thank you so much, Michael. I just wanted to add, of course, he's talked about some structural things, but I wanted to draw attention to the project itself, or the idea itself, in terms of the conceptualization. One of the things that our team had to think about thoroughly was language. Yes, the chatbot we are working on coming up with is going to be in English. Yes, and because of the population we are dealing with, adolescents who have deafness can use the text. But for those who have visual disabilities or who are blind, we are working to put in a voice-activated element. And for that aspect, we have consistently talked about the different accents that Ghanaians have across the country. So you'd realize that it's another thing that we need to train the model to be able to recognize. And I'm saying this, I believe, as an African continent, or a lot of people are joining from different parts of the world. If we talk about accents and how the AI or the machine would be able to respond, the chatbot would be able to identify that this is what the user is requesting or saying. So one of the strategies we have thought about is to pick on different accents as we go around the country. We are not going to every region, but at least we are going to, we've zoned the country into the North Middle Belt and the Southern Belt. So we are going to work on this as well as a way to figure out how responsive the chatbot would be in responding to the questions or concerns that adolescents might bring up. Yes. And the other thing is to also get the buy-in of different stakeholders right from the beginning, especially parents and guardians, teachers, health workers, so that as we move along, yes, AI represents different things for different people, but recognizing that this is something that we are working on to, be implemented positively. We want to get their buy-in from the beginning to mitigate any barriers that may come up. So these are some of the anticipated, these are some of the challenges and strategies that we have also worked on implementing. So just wanted to chip that in. Thank you.
No, this is excellent. It's excellent. And I would say, once again, for research teams especially, that is one of the outstanding problems we have with deploying AI within the African context, right? The diversity of languages. So those of you who know a little bit about AI, this would be under natural language processing, NLP, right? So just some ideas for research groups. The attempt to try and capture a wide range of accents, right, is a very, very outstanding problem. So this is something that I would encourage all of us to think about, to look into, and pool resources to try and address, right? I think that's an excellent contribution. Is there any more before we jump into our next question? Kindly keep your questions coming in. We are seeing them and we are taking note of them. Responses will be coming shortly.
Yeah. Could I just add on something little?
Yes, you can.
Thank you so much. Michael, I feel well represented. But just to add on something small, when we are doing AI, there are so many things that I've done. There is nothing that hasn't been done, but the only kind of contribution that we could make is to look out for marginalized sects or groups or communities. And what Michael's trying to address, or the previous speaker, was to look at these accents that are with a certain sector of the population that are not captured within technology. Because what AI does, if you develop something and you leave out a group, it just amplifies that problem. And them seeing that they are doing this to have what we call in responsible AI is inclusivity and equity. That when you develop the technology, you should be able to encompass that no one is left behind. Otherwise, you risk for your technology, however much it's fancy, it will be left out, or it will suffer a blow, because it will be amplifying certain things, a status quo that has been within the community. Or you might find out that that particular group with a certain accent that you have left out, maybe they didn't have even enough access to these health facilities, health services. And when you amplify the problem, it just collapses. It has not solved anything. Thank you.
Thank you so much. Thank you so much. This is excellent. This is excellent. Okay, let's take the next question. I'm sure some of the things we are talking about will come out as we take the next sets of questions we have. The next thing is, how did you ensure the ethical and responsible use of AI in your solution? Now, my mind personally had not gone to responsible use of AI when I started research into AI some years ago, but I've noticed how increasingly important it is. So, Michael, what was the consideration like? How did you think through it? Hello?
Okay, so before Michael comes in, I'm Sylvia and I'm part of the team.
Yes.
I want to respond to some of the ethical issues that we have considered.
Excellent.
So one of the main things that we did is to
Hi. Oh, okay. All right. Please go on.
Okay, thank you, Michael. So one of the things that we have done, aside submitting our work, our instruments and everything to the ethical committee of our university, which we have clearance for, is to look at the topic that we are dealing with, which is a sensitive topic, issues about sexual and reproductive health. And it's a very sensitive topic in the African context, and especially in Ghana. And therefore, there are values and norms that the society expects to see. And so we are not doing it strictly from our offices, but then we are getting involved all relevant stakeholders. So as part of the stakeholders, we are working with Ghana Health Services, we are working with the Ghana Education Service, and we are also looking at talking to parents and guardians of these adolescents, so that whatever be the outcome, it will be informed by these stakeholders, and therefore it will be context relevant. The context will be relevant for the people that we are dealing with, because every society and the things that they hold dear and value. And normally when it comes to adolescent reproductive health issues, it's tabooed. And so you have to be careful. If not, then you may even force parents to take away gadgets from their children, restrict them from accessing information online. So I think even one of the reasons why we are conducting or we are taking up this project is to make sure that we come up with something that is relevant to the context in which they find themselves in, so that they can get the right information. Because if you leave them out there, they may get information that may not be something that the society or the community or the educational system accepts, or they may frown on it. But then we are getting all these people's views on board, and we believe that it's going to shape it, so that it won't be something that we may bring it out there, but then policymakers and other stakeholders will say, no, this one is not relevant for our students. So the main point I'm raising here is the fact that we are getting involved, or we are involving all relevant stakeholders to make inputs in this. And so even the stakeholders, we're also including the adolescents, who will be the final people who will be absorbing or uptaking that information. So we are working with the adolescents, getting their views, and then we would also meet in various stakeholder meetings with the other stakeholders, relevant stakeholders that we have identified. That's just one side of it that we are
I think this is brilliant. I think this is excellent. So I hear you say one of the ways to approach AI in a responsible way is to include the end users or the group you are determining to design the solution for in the design of the AI itself, right? Yes. Include them in the design. I think that's beautiful. Unlike other technologies where you can build it somewhere and then bring it to your intended user and add a manual to it to show them how to use it. I think with the AI, if it's going to be responsible, you develop it together with them. So that's like to be owned. I think that's a very beautiful point. Michael?
Yes, I mean, to put things in perspective, I think you have to look at, just like you've said, and my senior colleague has made mention of. In fact, she's touched on biases, how to prevent biases. She's also talked about how to increase transparency by involving all stakeholders and, how do you call it, the end users, as you also noted. And that brings about trust. That brings about trust within the system. And then the inclusion of the collection of data, the inclusion and collection of data of all the various set of people that are going to be using this system takes away discrimination, right? So in a way, it's tied up to biases, reducing biases in the system. So yeah, these are some of the things that we've done, and I thank her for putting it brilliantly as she did. And
Yeah.
So all of this should be considered when you're ensuring ethical and responsible AI in your solutions.
I mean, this is excellent. This is excellent. I'm wondering whether Dr. Adjei, sorry if I'm putting you on the spot, from Villgro, from your perspective, that if you are still here, from your perspective, from the commercial side of AI and all of that, are there some unique considerations from a commercial perspective that perhaps come to your mind that you'd like to share?
Can you come again, please?
Yes. So the question about how to ensure that AI solutions are ethical and responsible. And I'm sort of curious about how you married that while also maintaining commercial interests. That's like from the entrepreneurial commercial side of AI. I'm wondering whether there are any conflicts or how you handle that.
Yes, there's actually a lot of conflicts in that area, because most of the young innovators that we are supporting, as I mentioned earlier, they've been teaching themselves. They acquire these skills out of formal education, maybe just online resources and things like that. So many of them, they didn't attend this ethical training. So what we are trying to do is we are combining them with experts in the field. You may find someone working in cancer, developing AI algorithm for cancer, but they don't have oncologists in the team. So what we are trying to do is to find partners who can assist these young innovators and make sure the way they obtain their data follow these ethical regulations. It is still challenging because these young innovators, many of them, they don't want to accept that thing yet. But putting in an oncologist or a radiologist in the team who will try to make sure that these solutions are being created ethically and responsibly. So it's a process. It's very challenging, but we have to start somewhere.
Wow, thank you so much. And I totally identify with that submission. Sometimes you are so excited as a researcher, you found something, the model works, but then translating that from the garage, from the lab into practice is quite a long process, and it's very important to consider these things. Thank you so much for your insight. The next question, I think, sort of relates with what we've been discussing, but we could just provide a summary, and then we'll look at our final question before we take questions from everybody else here. The next question is, how are you ensuring that your AI project considers gender, promotes inclusivity, and avoids biases in the healthcare or in healthcare delivery? So we are sort of being a little bit more specific about gender, inclusivity, and avoiding biases. Are there any considerations you'd like to share with us along these lines? Michael?
Okay. Right. So I think Dr. Mills.
Hello. Yes.
Would you like to touch on this, or I should?
Sure.
Okay.
All right. That's okay. I can start and then.
Okay.
So thank you, Prince, for your question. As a matter of fact, this study was birthed, or this project was birthed out of the realization that some populations within the larger adolescent group have been marginalized or sidelined or excluded, whichever we would put it. And so we decided to focus on one of such groups, that's the adolescents with disabilities, and specifically hearing, speech, and visual. So in the first place, that alone, is a way of including. In fact, we are certain that when this is done, even though our project ends at, like you use the word garage, but let's say before it's scaled up, we know that a lot of adolescents, even without disabilities, are going to benefit. But having conceptualized this AI, the chatbot, with them in mind, that helps even better, right? So that's one way of including, or that's one of the considerations we've made. Just to mention this briefly, if anyone is familiar with the Montessori system of education, Maria Montessori started it off with children with special needs, etc. And now it is a big kind of educational system that many schools use, whether or not they are admitting children with or without disabilities. So in a way, this is what we are hoping would be a bigger benefit, right? So by factoring in these adolescents who are usually excluded from mainstream interventions, we are hoping that when this is scaled up eventually, it's going to serve the bigger population, but definitely meet the needs of this previously excluded group. And most definitely, we are very gender sensitive about this. We are ensuring that we are engaging both girls and boys, adolescent boys and girls, in collecting the data that we are embarking on. Actually, in our pilot test, for example, a number of very interesting things came up that, so for example, a lot of the special schools in our country are residential, right? And the staff, teachers, and administration of the school truly grapple with how to get them to, understand their limits as far as, sexuality, or kind of be responsible, right? So one teacher told us about how they found, sometimes they will have random inspections, and they found condoms in one boy's stuff. And we guessed, we told him, we guess you took them from him, right? And he said yes, because as an institution, we cannot encourage that they would have sexual relations with each other. But Sylvia and I were discussing this subsequently, that what do we do? I mean, these boys probably have learned that if they want to be safe, they should use the condoms. But here they are in an institution where they are not allowed to, and no one is saying they should do it, but how do we grapple with these, should I say, barriers or constraints? And this is within a sociocultural context, totally understandable. So maybe to sum it up, yes, our population is already a group that is excluded, and they are the focus of our study, and we are trying to get different, both the boys and the girls' perspectives on this. And as thank you, I'll end it here.
Okay, so I hear you say the very formulation of your project is premised on gender inclusivity and avoiding bias in healthcare delivery.
Yes, and disability inclusion as well.
That's
gender and disability inclusion.
That's excellent. I'd like to hear from Lizwa, right? Lizwa is an expert in this area. That's what she's been studying for some time now. So it'll be interesting to hear her perspective on this as well. And then maybe I'll come back to you, Michael. So Lizwa.
Thank you so much. Yeah, I appreciate the sentiments that have been put across. I wanted to share just from the AI for PEP side that, we encouraged our grantees from the formulation of the project, that it starts with the team composition. The composition of the research team is very important, that it's also gendered, so that when we sit on the table to discuss at planning stage, even as we go to fieldwork, the questions that we ask, it's very important for us to ask the question, who is being included and who is excluded? How gender inclusive or transformative is this approach? By being deliberate in asking those questions, it challenges you to ensure that you follow and stick to the gender-based analysis and make sure that access to health is gendered. We already know that when we speak about health, we speak about a pattern of care in Africa and globally, a pattern of care that is inherently gendered. It's one of the things that came out during the COVID pandemic to say that women were carrying most of the care, the burden of care, the load of the burden of care. And what can we do to ensure that we alleviate that kind of structural inequality? Then the starting point is also to make sure that we're asking the right questions. We also adopt community participatory research methods that will also allow us to hear back from the stakeholders that we claim we are benefiting, to see how far we are benefiting them, and to see how far we are making an impact.
Beautiful. Thank you so much, Liz. It's particularly exciting to hear how important it is, the composition of the research team. I think that was so brilliant. That was one of the points that really stuck out to me, the composition of the research team. When you have a diverse research team, you would ask diverse questions because everybody would have a different perspective. So I think that was really exciting to hear. Michael, did you want to add anything? Then we'll ask our final question after here.
Okay, so these are very, very brilliant questions, brilliant input from her and Dr. Jan. With regards to the composition of the team, we factored that into it, and with regards to the set of data that we are going to collect. So we try as much as possible to make sure that both genders are featured almost equally, to make sure that the system at the end does not discriminate. And then with regards to inclusivity, because this is specifically for adolescents with visual and hearing impairment, they are the specific category of people that we are concentrating the system on, because they are those that the model is meant for. Okay, so I think that is the input I want to give, just to put things in perspective. Thank you very much.
Excellent, thank you. Unfortunately, we are running out of time, so I will jump to the final question, which I believe sort of encapsulates everything we've been discussing. And here I'd love, particularly if Dr. Degracious is still here, to also provide a view from the entrepreneurial side. Of course, Michael will provide a view from the SMRH side. And Lizwa, perhaps you could also jump in on the final question to also provide a view on that. So the final question is, with all the experiences you've had so far, the very last one, what advice would you give to researchers and then to entrepreneurs who are embarking on developing AI-based research or healthcare startups. I'm sure if you're a researcher here, by now you have gems. There are many things you've learned about how to write your next proposal, things to consider, and how to shape it, and all of that. I believe it to be same for entrepreneurs. So I'd love to hear from the panel what your advice would be for those doing research and for those doing entrepreneur. I'll start with Lizwa, if you don't mind. Lizwa, what would your advice be?
Thank you so much, Prince. The starting point is for us to know that you cannot blindly approach anything. Health is not a one-size-fits-all for starters. So it's very important for us to know that when we come to Africa, we are coming to a specific context where there's been research, existing research that has pointed on issues of social inequalities, economic inequalities, how we have been ravished by disease like HIV and AIDS, the pandemic that came before even COVID, the COVID pandemic. So we have to factor in those social inequalities as we structure our programs. You also have to ask ourselves, you know, the beneficiaries, how are we benefiting the people? If you are not benefiting the people, then how are you even intensifying the oppression? I think one of the speakers has mentioned that it's either you are mitigating or ameliorating the existing status quo, or you are mitigating it. I would like to add on the need for gender disaggregated data. We need gender disaggregated data like never before to make sure that, you know, we are inclusive, we are gender sensitive, we are also gender responsive and transformative in our initiatives. The community participation is also very important because the commercialization of AI is such that someone else has even eloquently put this to say that this is another form of colonization. So let's make sure that, you know, we are not extractive in the initiatives that we take on. Being extractive means that we are just taking data away from the people, not for purposes of advancing their livelihoods, but for our own self-gain. And that's not something from a social justice lens that we should be promoting. So if we are not working for the people, if we are not benefiting the people, then we know that we are not advancing in any social justice lens. Ask the right question, make sure we benefit the right stakeholders, and we also give it an opportunity to offer a voice through community participatory research methods. Thank you.
Thank you so much, Lizwa. Data is gold. That's what I'm picking from her summary. Data is gold. Data is very important. All right, so we'll take the next comment from Deogracious. Deogracious, are you around? From an entrepreneurial perspective. Dr. Deogracious? I don't think he's still here. Okay, Michael, maybe a final word from you.
Okay, Michael asked me to step in, so maybe.
Excellent. That's fine.
All right. I like what Lizwa said, and I think a lot of researchers are coming to that point where we just don't want to go take data from people and not come back. As a matter of fact, as we've been engaging with some of our stakeholders, especially at the education service, they asked us, we hope that we will hear from you. We want to know what you found on the field and know what it's going to. So that is so true. Just wanted to comment on that. And we are also excited, well, to also share that when we're talking with, as we've talked with the Adolescent Reproductive Health Unit of the Ghana Health Service, and they are excited about this project as well. And of course, there will have to be official discussions between us and HASH about, you know, what data we can release, etc. But the bottom line, what I'm trying to put across is they apparently had some technological measures that they were using, but realized the lack of inclusivity and have kind of gone back to the drawing board. So they were happy to know that we were working in that direction, and we are happy to, work with HASH and them, as in the health service, to see how we can integrate our findings, our projects, etc., for the greater good of the adolescent population. So yes, I would say that researchers and entrepreneurs definitely look out for how you can help, how your innovations can be helpful to your beneficiaries or end users, because that is what the world is looking for now. Thank you.
Thank you so much. Thank you so much. So I'll open the floor for questions. If there are any questions, I'll open the floor now. You can raise your hand virtually, and you'll be asked to ask your question. The panelists are here. We'll try to answer your questions. Are there any questions? I see some here from Francis Ngoy. I hope I pronounced your name right, Francis. You're asking, regarding infant mortality and given your strategies, what do you plan to do to build the capacity of those involved in the various countries affected? So Francis, I would strongly encourage you to visit the Global Health Network website, right? TGHN.org. I would encourage you to visit it. You would find tons of information that help build capacity, right? Tons of information, excellent information on diverse kinds of public health challenges. So that would be my response to you, right? Okay. Yes.
Maybe let me respond to Francis.
Okay.
Francis, when I was presenting, the unfortunate part of it is the presentation wasn't clear. It was somehow blurred. But you saw where we talk about stakeholder engagement and also capacity building. Now, this is just the first phase. The stakeholders of those countries are the sub-grantees, and we are building capacity. They understand better the pertinent issues that such communities are grappling with. There is a blanket umbrella and the vision that we have about the communities, but the intricate details of the matter are known by the people themselves. So the main strategy for HASH in this topic that you've talked about, where we are tackling, is to build capacity. And we said for homegrown AI. And the most theme that you are doing, or the blanket that we are using, is for gender equity and inclusion. And this was a pertinent issue in our sort of talking to the sub-grantees or sharing these ideas with them. And as you've heard, the previous beneficiaries from Ghana, they've said about HASH, they come back to us. We ask them, in their opinion, why have they left out certain things? Is there other ways they could explore to close such gaps? So when we interact and we exchange these views, they go back. There are various tools that we get from a peer learning journal for women at the table, is a gender equity and inclusion. And I would like also to correct about the thing of gender. We've reduced it to male and female. We rather say sex. You are biologically born female or male. Today, the word gender has evolved. So I would like, in the context, maybe by law of a country has prohibited you, but the globe, the universe today looks at gender in so many diverse ways. It's no longer binary. So if you have these communities, inclusivity of these communities within your technology is very key also for your success, though there are so many other pending issues that cannot only be known by the stakeholders or by the communities that you'd like to develop this technology for. Thank you.
Thank you. Thank you so much for those comments. I'll just read a final one for Sylvia. The University of Ghana. I think you would find this very interesting. It says that, this is from Judith from Ghana. In line with what Sylvia said a little bit earlier, we know that sexual reproductive health is a sensitive issue. Hence, the information being provided by the chat box needs to be accurate, trustworthy, and authenticated. If applicable to your project, she would like to know if there have been any inclusions or considerations of databases or data sources that would be utilized as the knowledge base for the AI chat box.
So just to come in quickly, we plan on whatever data we would end up feeding or modeling our program with. We intend to present it to stakeholders who would okay it first. That's why we have identified the stakeholders. Initially, had it not been for the fact that now we want it to be inclusive and we want it to be ethically correct and all that. Normally, as researchers, we go to the field and then we identify the people we want to interview, get the data, and then that is it. But this time, aside the people, the end users, we are also looking at people who have a voice, people who come up with policies, people who have the well-being of these adolescents at heart, and people who will be working with them, whether directly or indirectly. So we'll always come back to these people. When they buy it into it, they guide us, we shape it, and it will be something that is owned by everybody. And then it will be relevant to the context in which we want to apply it. That's the uniqueness of our project, because there are a lot of information out there, but this time we want to make it context specific for these adolescents. Yeah.
Excellent, excellent. Thank you all so much. All too soon, we've come to the end of our webinar. All your questions will be answered. We'll send you responses. And you can also find a recording of this webinar on our Knowledge Hub, the AI for Global Health Knowledge Hub. It will be sent to all of us via mail shortly. Thank you very much to the panelists and to you for your participation. We will bring our session to an end and close it now. Thank you very, very much.